This is a screencast just to recap and hopefully develop your understanding of lung volumes so that we can progress on to discuss how they're impacted in various different pathologies that we'll discuss as part of the pathology recognition series for the PRP module. So this is the standard lung volumes and lung capacities curve, and it's representing the various different volumes that we can utilise, ranging from our normal tidal volume through to the maximum breath in and the maximum breath out. Okay, so what we're trying to depict here is how the chest wall is moving on the breath in and the breath out, and how that's represented on the tidal volume here. So as you can see, you're getting some chest wall movement, but we're only utilising a relatively small proportion of our total lung volumes. So I'll just move this on a little bit further. You can see that we go from a normal tidal volume through to a slightly bigger breath in. So the bigger breath in, you get more chest wall movement and a greater curve represented on the diagram up here. So what's happening as we're taking a deeper breath in is we're utilising our inspiratory reserve volume until we get to the maximum amount of air we can get into our lungs, which is defined as our inspiratory capacity. So going back to the lung volumes curve again, we've covered tidal volume and inspiratory reserve volume and inspiratory capacity, but we also need to consider the implication of the breath out, and we have the ability to breathe out maximally and expel as much air as possible from our lungs, but we will also have air left in our lungs after that maximum breath out. So the amount of air left in the lungs after the full breath out is known as our residual volume. But the amount of air left in our lungs after a normal breath out should be considerably more, and we define that as our functional residual capacity. Now it's important to consider our functional residual capacity relative to the position your patient's in, their diaphragm function, whether there's any lung pathologies, and as we go on to explore obstruction and restriction in more detail, I want you to think about where the functional residual capacity sits for a patient who perhaps has obstructive lung disease or pathologies versus restrictive lung disease or pathologies.